This is going to be our trigger point for our hip flexors, our Psoas and our TFL. Good old Bonesies here are going to show us where that is located. It's a little tricky, but we're going to lay on our back. I'll take you through it, but to see the anatomy, if we go to this bone, if you touch the front of your pelvis, you'll feel that bone. We're going just to the inside of it, right? It's a sensitive area. You want to start kind of slow here, work yourself gently into there, but that's going to get up and into the Psoas. There's going to be another exercise that we give you that's called the TFL, which is going to go below that into the outside. So you learn this in clinic. You may need to practice a little bit at home, but make sure that you're not overdoing it and pressing too hard in the abdominal region. When you do this right, you should feel that there's therapeutic relief to these tissues. So the first thing we're going to do is aim in for that psoas. Remember, that's coming from the lumbar spine, coming down the front of the pelvis, and then down into the inner side of the hip. We're going to be able to locate the region right in through here, not up and in through here. Your intestines lay on top of that, so that's not super comfortable. So try to keep the treatment zone down through here. What does that look like? Well, we're going to use our J cane, our trusty J cane. We're going to use this sort of like shorter nub on this section. We're going to lay on our back, our knees sort of slightly bent, so there's some relaxation in there. We're going to take that, use this hand to drive it in, go to that bone, go to the inside of it. We're going to press it in and back it up with this hand. Now, it doesn't take much pressure to feel it, and you'll not want to go very hard into here. So searching around, finding that muscle. Bring that thigh up. That'll help you dig in there. There it is right there. You can feel it. You've had it in clinic. You can replicate it. Now, once I'm here, I'm going to slowly, very slowly, try to drop that leg back down. We're going to bring it up. I take some of the pressure off of this. I build the pressure again to the next one. Maybe 4 or 5 pin and stretch passes. Usually it hurts kind of good, feels therapeutic. You don't want to push too crazy hard. And I'm even pushing this up in and maybe slightly up just to feel that sort of stretch out. It's aiming from your hip towards your belly button is a good line of drive to think about. Think about belly button to the hip. That's where that muscle goes. So we're really trying to hit this area right here. You'll see that that little nub goes in there really nicely, and you'll find that feels really good. Now we're going to sit up. Here's that bone. Now we're going to start to aim for the TFL. Let's show you that one. We get up. I like to do this in a sitting position. I'll show you here why in just a second. But we're going to sit, and we'll still use that same area, and I'll show you on this right side that right here, here's that bone again. Now, if I go below that bone and slightly out, just on the other side of it, I'm going just on the other side of that bone right here instead of the inside, now the outside, and I sink just straight down. Just go straight down. That usually will make your eye tingle a little bit. You know you're in the right area. And just do a little bit of kind of light little self-massage in there, kind of soften that tissue, desensitize it, even kind of coming out to the outside part of it, you'll find all that tissue. You're still on the front side of the hip. Now, once you find a good spot, another little trick is to hold that and to slowly and smoothly get up. And as I get up, I'm pushing that ball down towards my knee, actually. You'll feel a good pin and stretch release to your TFL, your tensor fascia lata. That muscle tends to be short on us because we've been in hip flexion more than we haven't. Our cyclists a lot, our daily office sitters, a really magical muscle to hit that's oftentimes missed. And it's starting in this position, pressing it down and getting up and working that out so it feels less tender and less tight.